Hello, my name is John Boone. I'm a medical physicist from UC Davis in Sacramento, and this talk is entitled Translating Protocols by Scanner, Manufacturer, and Model Type. So, tube current modulation is the standard method acquisition technique by which most CT scanners are operated, especially in body or abdomen pelvis scans. And you can see on slide 2 here, one scanner has a certain tube current modulation scheme as shown in the red line, whereas another scanner has a completely different approach to modulating the dose and the technique factors, the effective MAS here, for that same patient. And so these represent some of the challenges because you have these different modulation schemes. You also have a widely varying nomenclature between the various CT manufacturers. Their tube current modulation nomenclature in particular is quite different, and also is different in terms of how it behaves numerically. So we'll explore that in this short lecture. So the purpose of our task here is to develop a method for matching the noise and dose from one scanner to other scanners with the rationale that the radiologist has spent a fair amount of effort protocoling, optimizing the protocols on one scanner manufacturer and type, and when the institution purchases new CT scanners that are different, rather than having to redo all that effort, we could use some method by which to develop the protocols of a progeny scanner, of a second scanner. The other purpose is to compare image noise texture between scanners to match kernel selection, and this I'll talk to you about from a recent paper that was published in the literature from Duke University that I thought was quite interesting and useful in this regards. So with respect to protocol translation, the idea here is to use a reference scanner for the protocol, the one that has been worked on by the radiologist and their satisfactory protocols. But then we come up with we need to use some form of a translation metric and use that metric to come up with new protocols for a variety of different progeny scanners. So progeny scanner just refers to other scanners that you want to match the original scanner's protocols to. And so our reference metric we have used in this work on both CTDI-W or CTDI-Air. CTDI-W in this case is that measured in a 32 centimeter diameter PMMA phantom, and CTDI-Air is really just the dose at isocenter, really the air current at isocenter measured in the absence of a phantom. The numbers should compare similarly, of course, and we'll see that is in fact the case. So here is just a pie chart showing the prevalence of abdomen pelvis protocols at UC Davis on slide 6 here. And at our institution, as well as many others, the abdomen pelvis CT scan is widely used for a number of different a number of different indications. So image acquisition, our reference scanner really was a GE Lightspeed 16, which we had several of, and the two progeny scanners that we'll use in today's example are a Siemens AS Plus, a definition scanner, and a GE volume CT scanner, a VCT. And we looked specifically at tube current modulation, TCM technique factors. We made use of a phantom that we constructed here in our laboratory. It had 5 different diameter polymethyl methacrylate sections to it from 10 to 32 centimeters, as you can see here in slide 8. These were held together, and that was essential so that all of the cylindrical phantoms would be located at the isocenter of the scanner, and this would be centered in the acquisition gantry. And this was accomplished with a rod that held this stack of phantoms together. We call this the wedding cake phantom for somewhat obvious reasons. So after scanning over a wide number of scanners and technique factors, we developed an analysis tool that is shown in this slide, slide 9. And this is a MATLAB-based software that we developed in-house. And it shows the technique factors for a given scan. It also generates a lateral projection, as you see here in slide 11. We can also evaluate the MAS per pitch, and this is also known as the effective MAS. So I'll use that term a lot, effective MAS, in this talk. And so the definition of effective MAS is the MAS divided by the pitch factor. We also can go in and analyze the diameter of the phantom section, and that's what's shown in this pane here, the phantom diameter as a function of slice position. So we focus in, you can see the red lines here, focusing in on the 25 centimeter diameter PMMA phantom, which is typical for a small adult, and later on we'll address all of the phantom diameters, but most of this is about this phantom. We blow this value up here and can see that we've selected this section. So when imaged across 3 different scanners, the reference scanner, which again is the GE Lightspeed 16, then a GE VCT and a Siemens AS Plus, you see here are the data. So what we've done is we've used the reference mass, which is the tube current modulation term used by the Siemens scanner, and that's across the top axis. We've used the noise index in blue at the bottom of this graph, and the noise index is the parameter used for tube current modulation in General Electric CT scanners. And from this we've measured the average effective MAS, and we pulled that from the DICOM header. And you can see that there's a nonlinear relationship between the GE metric, whereas there is a linear relationship between the effective MAS and the reference mass with the Siemens scanner. And that begs to the difference in the way that these metrics have been defined. So our method for translating protocols from one scanner to another is either to use CTDI air or CTDI W, as mentioned before, and to form a proportionality here such that we can deliver the same average effective mass based upon these protocols. So on the slide, on the graph on the left, we have the reference scanner. So the x-axis on the slide on the left is the GE Lightspeed CT scanner. The y-axis on the left curve is the General Electric VCT scanner. And you can see that there's a linear relationship between the noise index values because these are both GE scanners. And you can see that the line of identity is fairly well matched, as you would expect, between 2 scanners, different models, but the same manufacturer. On the graph on the right, however, the reference scanner refers to the GE Lightspeed 16 scanner, that's the x-axis, and the y-axis, the progeny scanner, is a reference mass, which is the term used by the Siemens AS Plus. You can see there's a nonlinear relationship there. And so this essentially provides a lookup table between the noise index term and the reference mass term between the GE 16 scanner and the Siemens AS Plus. Now, in this previous slide, this was using CTDI air with the blue graphs, and we can also use the CTDI metric when the phantom is there, and you can see in slide 19 that the results are actually quite similar, not surprisingly, between CTDI air and CTDI W. So this really doesn't show much difference, and so either one would probably be acceptable for most scanner protocol conversions here. So what about the diameter of the phantom? The data that I've shown heretofore are really for the 25 centimeter diameter polymethyl methacrylate phantom. This data shows all the different curves for the 6 different diameter sizes, showing the relationship between the noise index and the effective MAS on a GE scanner. And clearly, for the same noise index, the effective mass needs to increase for larger phantoms, and that's what's shown on this curve. But when we look at the ROI noise, the measured noise on the scanner as a function of noise index over a range of different phantom diameters, you can see that this all falls on the same line. Of course, if it was a perfect line, that would show perfect behavior of the tube current modulation scheme of this in the case of the GE scanner. Where you see a slight breakdown from linearity is really for the 2 small phantoms, the 13 centimeter diameter phantom and the 10 centimeter diameter phantom. The reality is that those are very small, and what we've done here is hit the minimum setting, the minimum output, and it couldn't go any lower. So it delivered even lower noise than what was requested, and that's why those 2 lines, the purple and the blue, are below the rest of the lines there. But in general, this plot illustrates the fidelity of the tube current modulation as a function of patient diameter, or the phantom diameter in this case. When we look at the individual sections of the phantom from 32 to 13 centimeters, we can see that there's a slight variation between these lookup tables, between the reference scanner, the Lightspeed 16, and the VCT on the left plot, the Progeny scanner, and on the right plot, again, the GE 16 slice scanner versus the AS Plus Siemens scanner. And you can see there is some slight deviations that you observe here, especially on the right curve, and that's perhaps not surprising. And so this may suggest that a more robust protocol matching scheme would take into consideration the diameter of the patient, or the overall size of the patient, as well as the reference scanner noise index in this case. So I wanted to change themes here, and we've been talking about essentially matching overall noise levels, but it's well known that the different manufacturers actually have different kernels which produce dramatically different noise texture, the way that the noise looks to the radiologist's eye. And this paper, which was published last year in 2012 by a scientist from Duke University, really addressed this issue quite well. And so I'm just going to share a couple of the results that they found, and this is published in the journal Medical Physics. So these investigators measured the noise power spectrum, as you see on this plot, which is a function of spatial frequency for a range of kernels on the GE, on the scanner shown on the left, and on the Siemens scanner shown on the right. And they use different ways of naming their kernels, and you can see that in this plot. This is slide 24. So then they actually came up with a method by which they compared the similarity between the response functions, the noise power spectrum, and showed which GE kernels best matched the Siemens kernels, recognizing that Siemens uses a large number of kernels, more so than does GE. And the yellower values you can see on the scale on the right in this plot correspond to a better match. So that gives guidance to what the best GE kernel matches up to in terms of a Siemens kernel. And they did the work for us, thankfully. And so one of these tables, this provides the closest matching Siemens kernel for a given GE kernel, and you can see this data in slide 26. And they also, if you have to do that match in the other direction, they provided that table as well. So this is the closest matching GE kernel for a given Siemens kernel. So this is quite useful and really represents a large amount of work on the part of these individuals at Duke University. So in conclusion, a tube current matching based upon matching dose metrics, and here we use CTDI-W and CTDI-air, is quite feasible and worked quite well, we thought. The protocol translation may have a patient size dependency, dependent upon how accurate you really want it to be. And future work could combine the above two bullet points with the noise power spectrum, and we see from the work from Duke University that the NPS can be used to match image texture quite well between scanners which have a different assortment of CT kernels. Thank you.